Hello and welcome to a video on how to properly diaphragmatic breathe. I'm going to give a different perspective than many have heard, so excited to share this perspective. My name is Dr. Justin Ternes. I'm a physical therapist and a breathwork specialist. And I want us to start in the seated position so you can watch and listen if you'd like, but most preferably you're sitting upright because I want you to feel as you're listening, as you're watching, I want you to engage and breathe along with me in this new way to diaphragmatic breathe. So traditionally, right, we're taught that a diaphragmatic breath is a belly breath. Quiet upper chest, lower hand stomach moves. As you inhale, the stomach pushes out, belly breath. Quiet upper chest, exhale, stomach pulls in, and you blow the breath out. And I see a lot of people learning this concept, and I want to wipe away that concept, just release it, right? Because what I find is that there's a fixation in breathing into the belly because it's diaphragmatic and because diaphragmatic is better. But what happens is we restrict a full and efficient breath. So if you're only breathing here and you're quieting your chest, you're also limiting the way in which you breathe fully through your lungs. And where are your lungs located? They're located low in the diaphragm, in the side ribs and the posterior ribs, but also into the upper chest, upper clavicle, upper back region, right? So a full breath is an expansive breath. And yes, we can isolate the diaphragm and bring a little bit more focus on the diaphragm to exercise that muscle, because the diaphragm is a muscle. It's our primary respiratory muscle. And you see me using my hands here. And this is how I like to visualize the diaphragm, because the diaphragm is our primary respiratory muscle. It's also one of the largest muscles in our core abdominal region, right? So it's a massive muscle that spans at the base of the ribs, around to the low back, into the spine. And it's a dome-shaped muscle. So you see me doing this, and I'd like you to do this as well, where your hands are making this dome. And as you inhale, that dome-shaped muscle, the diaphragm, flattens. And as that muscle contracts and flattens, you're pulling breath into the lungs. So that is an inhale. And as you exhale and relax, the diaphragm relaxes, lifts up. And then other supportive muscles can support the exhale out. So abdominal contraction can squeeze and blow a little bit more air out. So the diaphragm, as it flattens, holds air in. As you exhale, it relaxes and returns to that dome resting shape. Another breath in and let it go, relax. Right, so notice my diaphragmatic breath, I'm not even thinking or acknowledging the belly. Naturally, there is a little bit of movement of the belly forward, but also the side abdominal region widens, and then the low back expands, because again, this three-dimensional inner tube space inflates and contracts and pulls out as you diaphragmatically breathe. Another way in which I think about this, and I like using the visualization because it's kind of a hard muscle to feel and see. It's so intrinsic in the body, but you can effectively get to a point where you're able to feel it contract, feel it drop. But every now and then, it's always nice to use a visualization and imagine that dome drop down. Also, the hands can support the visualization. So doing a couple, right? All the way in, low, and let it go, relax. And what you'll notice is my upper chest does move as I take a diaphragmatic breath. My elbows are kind of splaying out, my ribs are expanding, because I do want to re-articulate my rib cage. I want to re-articulate my spine. I want to create some core and hip pelvic stability to help support that muscle to anchor and widen. Another way in which I think about this is the pulling of the breath from the diaphragm flattening is kind of like it's like a plunger. I call it like a reverse plunger. Stick with me here, right? So you have a plunger that goes up into this dome, and as you breathe in, the plunger pulls that diaphragm flat. And as you do so, you can feel the air suction its way in, and then it can relax out. So sometimes, let's try this one. Dome with one hand, plunger in the middle, and you want to think about this central line of energy and pull right in the middle of the diaphragm, so right in the middle of the core. And as you inhale, you're pulling this plunger down, effectively flattening the diaphragm. And as you do so, give yourself some grace to move throughout the whole body, because what happens as you pull air in and anchor down, guess what? You're also pulling air expansive into those side ribs. Naturally, you're going to fill up vertically. So the plunger pulls, the diaphragm suctions down, and you fill with lungs. And notice it might feel like an even stronger diaphragmatic breath. And do any of you feel that owning, that contraction in the low back? Let's angle and focus back there. So bring your mind's awareness around those low ribs on the back. And as you pull, can you feel that kind of pull back and expand? And then as you exhale, you can relax. And then another. And let it go, relax. So as we get into this practice and familiarizing ourselves with a proper diaphragmatic breath, notice how the other way of teaching belly breathing just feels like it's inadequate. It feels incomplete. And so I wanted to do a lot of relearning here. Again, most of us know that diaphragmatic breathing is quiet chest, belly breathing in and out. But let's reframe it and reassess and really re-expand the way that our diaphragm breathes. One last point here, okay? The last point I want to make is that a diaphragmatic breath is low, expansive, and wide. But we also have ribs in the upper chest, side ribs, upper back that we want to expand in order to take a full breath. So a diaphragmatic breath is not a full breath. I also see a lot of people with the understanding or the fixation that diaphragmatic breaths are the best way to breathe. And what they fail to understand is that a diaphragmatic breath does not allow you to take a full, expansive breath. If we're in a state of hyperventilation or panic or over breathing, chronic stress, we do tend to breathe up into our upper chest. But this is an involuntary breath movement. What I want to remind you is that breath is a voluntary action. So if we're breathing full and deep, expansively into our shoulders, even our shoulders shrug up, that's not bad. It is voluntary. It is a practice in which you are purposefully expanding all of your breath. So the full breath that I would like to lead into from the diaphragmatic breath is initiate. Let's get our hands together. Initiate the breath by flattening the diaphragm and pulling the breath in. And then finish and open off the breath with the hands opening. So this is a two-part practice where you flatten, diaphragm, and then upper, expand. So it's a two-part inhale. So notice you can't fully inhale only through your diaphragm, because guess what? There's always a little more space when you open and lift your spine, open your chest, and expand your ribs and expand your lungs. Let's play that a few more times. So initiate diaphragmatic, open, expansive upper chest, and let it go. Two more. In, and let it go. One more. And let it go. Notice how that affects the way that you feel. Notice how that affects that you feel like you're breathing. Take a moment to even close your eyes and breathe normal, breathe calm, breathe normal, but also breathe in a full, slow, integrated, expansive, diaphragmatic way. And notice that this is very different than a belly breath. This is a full body breath that fully utilizes and optimizes the way that your body and your lungs ventilate, bring air in, and release air out. Thank you for watching. Thank you for joining. Play with this. Share with your other breath friends out there. Leave a comment below, and thank you for joining.